Ever wondered how you can safeguard your health against certain cancers? Did you know that a simple vaccine can potentially prevent one of the leading causes of cancer in women? Today we're talking about the cervical vaccine, also known as the HPV vaccine. What it is, who should get it, and why it's so important. Before we dive into the vaccine itself, let's first break down what HPV actually is. HPV stands for human papillomavirus. There's no need to panic. In fact, HPV is the most common sexually transmitted infection out there. And you might be thinking, oh no, I've had unprotected sex. Now what? Don't worry just yet. There are more than 100 types of HPV. Some of them are totally harmless, while others can cause cancers like cervical, vaginal, vulvar, anal, and throat cancers. So, not all HPVs are created equal. And thankfully, the vaccine we're discussing today targets the types that are most likely to cause those cancers. You might be wondering, how does this virus work its way into our bodies? Well, imagine this. You're engaging in some friendly banter with your partner, laughing, enjoying the moment, when suddenly, oops, skin-to-skin contact happens. And that's all it takes for HPV to jump from one person to another through skin-to-skin contact. Yep, you heard that right. It doesn't take much for this virus to find its way into your system. And once it's in, it can start infecting cells. Specifically, it targets the ones deep within the tissues. However, your body's got some pretty powerful weapons at its disposal. In most cases, the immune system steps in, kicks the virus out, and sends it packing. But sometimes, and I mean sometimes, the virus might stick around a little longer than expected. That's when things can get a bit tricky. If HPV sticks around too long, it starts messing with the DNA of those infected cells. Think of it like corrupting a file on your computer. When this happens, cells start growing out of control and abnormal growths or lesions can develop, and that's when the risk of cancer starts to creep in. Not all HPV infections lead to cancer, but it's a risk we should definitely take seriously. Let's talk about the main star of the show today. The cervical vaccine, also known as the HPV vaccine. This incredible shot is our shield against the troublesome types of HPV. Currently, we've got two types of HPV vaccines available, Cervarix and Gardasil. Let's focus on Gardasil, which is the most commonly used one. Now, here's the cool thing about Gardasil. It protects against 9 major HPV types. Of those 9, 7 are cancer-causing and 2 are responsible for common warts. It's important to note that the cervical vaccine is a preventive measure. It won't help if you already have an HPV infection. It's all about preventing infections before they happen. So if you're thinking about getting the vaccine or have questions about it, talk to your healthcare provider. They'll be able to guide you on whether it's the right choice for you. And the best part, if you're not sure which vaccine to go for, both Cervarix and Gardasil are equally great options. Now, let's get into the nitty-gritty details of the cervical vaccine. First off, it's important to know that there are different types of the vaccine depending on the brand and what you're getting vaccinated against. Some vaccines require 3 doses, while others need just 2. The usual dosing schedule goes like this. If you're under 15 years old when you start the vaccine series, you'll need 2 doses. And if you're 15 or older, you'll need 3 doses. It's like a roadmap that helps us understand how and when to receive the vaccine. Remember, the cervical vaccine is designed to keep you safe from harmful strains of HPV. Once you've had both doses, you're good to go. No need for any additional boosters. When it comes to who should get the vaccine, the answer is pretty straightforward. Everyone who hasn't had it already. It's the best way to protect yourself against the harmful types of HPV for individuals who haven't received any doses. The recommendation is to start the vaccine series as soon as possible. Most experts suggest starting the vaccine when you're 11 or 12 years old. This is usually when the vaccine is first recommended, and it's often administered during routine doctor visits. However, don't worry if you're a bit older, because it's never too late to get the vaccine. The upper age limit for the cervical vaccine is currently set at 45. Up to 26 is the recommended age for catching up on vaccinations. Beyond 26, it's more of an individual decision that's best made in collaboration with your healthcare provider. You might be curious about how well the cervical vaccine works. And the answer is really impressive. Clinical studies have shown that the vaccine is about 90% effective in preventing HPV infections that cause about 90% of cervical cancers. That's a pretty significant chunk of cases we're talking about. It's like having a shield against a major threat. And if you're wondering if other countries that have high vaccination rates see a drop in cervical cancer cases, the answer is yes. Countries where a large percentage of the population has been vaccinated against HPV have seen a sharp decline in precancerous cervical lesions caused by the virus. This trend shows us the potential impact of widespread vaccination, and it's a positive sign for the future of cervical cancer prevention. Now let's address the safety aspect. Is the cervical vaccine safe? In short, yes. In fact, over 100 million doses have been given in the United States alone. And in general, the side effects are mild and short-lived, just like with any other vaccine. Some people might experience soreness at the injection site, while others might feel feverish or nauseous. These symptoms are usually temporary, and they go away on their own. Now, if you're concerned about the safety of vaccines in general, I encourage you to reach out to your doctor. They can provide you with accurate information and address any specific worries you might have. One of the questions that often comes up is, does the cervical vaccine cause infertility or autoimmune diseases? Well, there's good news. Studies have confirmed that the cervical vaccine doesn't cause infertility or autoimmune diseases, so it's safe for both men and women to get the shot. You might be wondering why more people aren't getting the cervical vaccine. Vaccines have the potential to save lives, and it's important that we do everything we can to protect ourselves and our loved ones. The cervical vaccine is one of the most effective tools we have to fight against certain cancers, and yet uptake isn't as high as it could be. We're working towards increasing awareness and encouraging more people to get vaccinated. But it's crucial that we also understand and address the barriers that are preventing widespread adoption. Some common reasons include lack of access to healthcare, cost concerns, misinformation, and fear of needles. By understanding these challenges, we can work towards developing strategies to overcome them, whether it's making vaccines more affordable, providing educational resources, or improving access to healthcare. Each step we take brings us closer to a future where preventable diseases become a thing of the past. Currently, about 78% of teens in the United States between the ages of 13 and 17 have received at least one dose of the vaccine. However, only about 63% are fully up to date with the recommended doses. There's still a significant portion of the population that needs to catch up. Use protection, get tested regularly, and stay informed about your sexual health. Don't forget that even with the vaccine, women still need to get regular pap smears and HPV tests starting at age 21. The vaccine covers 9 types of HPV, but it doesn't cover every strain. So screening, along with vaccination, is the most effective way to protect yourself against cervical cancer. So what do you think about the cervical vaccine? Do you think HPV vaccines should be mandatory in schools? Share your thoughts in the comments section below. And don't forget to like this video. Subscribe to our channel and hit the notification bell for more informative content. Thanks for watching. I'll see you next time. Bye!